Hello class, today's lecture is on administrative considerations in our therapeutic modalities class, athletic training. First, we're going to discuss our objectives. We're going to discuss how regulation of athletic training is controlled through different bodies, but ultimately by individual states. We'll define licensure, registration, certification, and exemption. We're going to display an understanding of informed consent and how it relates to the practice of athletic training. Define a tort. Discuss the necessary components to prove negligence, and lastly, discuss defense against negligence and risk management. So CATE, the Commission of Accreditation of Athletic Training Education, establishes the criteria for accreditation of educational programs, so they're over the educational programs only. The Board of Certification administers the national exam, and then the NATA, or the National Athletic Trainers Association, sets their standards of practice. Such as the Code of Ethics in 2005 or the Role Delineation Study in 2004. But the practice of athletic training is governed by each individual state through a Practice Act. So if you look at this website here from the link, that is the Practice Act for the state of Arkansas. Let's look at our scope of practice. This is the legal boundaries that define the manner in which the clinician may practice. So state by state, you may have licensure, which was what we have in Arkansas. It's the most restrictive. It sets standards, and it protects the title. So some Joe Blow that knows how to tape an ankle can't come in and take an athletic training job without a license. So if you have a license and you're looking for a job, somebody's not going to beat you out a job that does not have a license. Then you have, some states have a registration where you just register with the state board. They have a few prerequisites that you have to meet. And then other states just have certification, defines the scope of practice, but no protection of professional title. So you look at the personal trainers, you could get your CSCS, your Certified Strength and Conditioning Specialist. So that's just a certification. So then that allows you to go out and start doing personal training, lets you do strength training, but you really have a wide range of people who really know what they're doing and other people that don't know so much what they're doing but were able to pass a test. So that really doesn't protect you professionally. And then lastly, exemption allows one profession to perform the work of another. So you can have a chiropractor doing the work of an athletic trainer. You can have a physical therapist or an occupational therapist doing the work of an athletic trainer. So that doesn't really protect your title, doesn't protect your job. And then here's the rules and regulations at that website for the Arkansas athletic training. Then in our scope of practice, we have position statements. The NATA provides a lot of these, such as heat, concussion, MRSA, and those type of things. And then on a local level where you work, you will have a policy and procedures manual. Here's just a rundown of the states. So the bulk of the states have licensure now. One state has certification, that's South Carolina. Looks like we got 5 states that just have registration, and then good old California has no regulation at all. So if you don't pass your board exam, just move to California. Let's talk about informed consent. Informed consent is a really important part of athletic training that maybe you don't really think about. Before you touch an athlete, before you do anything with an athlete, you have to have some informed consent. This can be something as simple as just a discussion, maybe a nod of the head, here's what I'm going to do, and they'll allow you to do that. We really establish our practice and our care on informed consent. It was originally established to protect human subjects in research. So you think back to like the World War II era, in which the Germans did all kinds of human experiments. They obviously did not have informed consent or tell these subjects what to expect from these experiments and what the long-term effects of the experiment. They basically had them against their will. So we use this to foster trust between the athlete and athletic trainer. Depending on your setting, it may also be to foster trust between you and the parent as well. It spells out to the athlete specific treatment proposed for the purpose of improving their condition. This includes a short and long-term medical risk in the plan. In plain, understandable language that the athlete can comprehend. So if we're using a bunch of medical jargon talking above their head, then it's not a good informed consent. So we just need to tell them exactly what we're going to do in a way that they can understand it. This comes from public policy that every adult has a legal right to determine what to do with their body. So you cannot make me or force me to have a treatment against my own will. And again, looking there, adult is one of the key words. So if you're dealing with a minor, then you're also dealing with their parent. So informed consent as an ethical guideline for practice. So you can have an act of offensive touching without the consent of the one being touched, regardless of the motive or the effect of the touch. That's battery. Sometimes watching some of the SOAS releases that occur in the clinic, I'm wondering if maybe we don't have some battery going on there. And if you try to come up and give me a hug, I will consider that an act of battery. Growing up, I would always hear on the news someone was charged with assault and battery, and I was wondering why you would have salt, like table salt, and a car battery together, and why that would be something enough to get arrested for. Anyway, then let's talk about liberty. That's self-determination. So every competent person has the right to know what will happen to them. So a disclosure ensures self-determination. So you may have an athlete, you say, hey, you really need a SOAS release, and they just watched the athlete on the table next to them screaming and squirming around and yelling, and they don't want that. And if they say no, then no means no, and we can't do something against their right to refuse. So that's self-determination. And then we have a special trust or confidence with our athletes that we will act in good faith and in interest of their health and their well-being. And that establishes a fiduciary relationship with that athlete. And that's very, very important that we have that confidence from our athletes, because if our athletes do not trust us and they don't think that we have their best interest at heart, then they're not going to come to us, and something bad could happen if an injury is missed that should have been treated by us. So now let's talk about further legal consideration. So minimal legal duty, we think of the Hippocratic Oath, first do no harm. So we don't want to make any condition worse. So if you have somebody with a bone sticking out of their leg, we're definitely not going to go in there and start mobilizing that and start moving them around a lot. So we don't want to create any further harm than what's already there. We have professional ethics and responsibility that our care provided is in the best interest and to meet the goals of the athletes. And then as modality operators, we must know the effects, the side effects, and the contraindications for each modality that we use. So modalities are probably the one area in which we're the most liable or most likely to come in contact with the things that we're talking about today and actually causing some type of harm. I know whenever I was in physical therapy school, I remember they were talking about the hot pack burn being the most common legal tort or lawsuit against physical therapists at the time, because that modality, if you don't pat it enough, then you're likely to burn the skin as hot as it is. So we need to know the effects of the modality that we're using. We also need to know any side effects so that if we see that, then we can quickly remedy that situation and get them out of the situation. And then we need to know when not to use it. We need to know our contraindications for each modality that we use. Now, legal liability. Liability is legal responsibility for the harm of another. A tort is a private wrong or injury suffered by an individual as a result of another's conduct. An injured individual has a right to be compensated through recovery of damages. So these could be intentional or they could be unintentional, which would be negligence. Now, for negligence to be satisfied, we need to be able to prove four things. We need to be able to prove duty, breach, cause, and actual harm. And the burden of proof does not lie within us, it lies with the plaintiff. So whoever is bringing the lawsuit against you must be able to provide proof that these four things happen: duty, breach, cause, and actual harm. So now let's look at these individually. So duty is a duty of care owed as a result of a relationship that exists between parties. So possible recognized legal duties in athletic training: we have the duty to properly assess the athlete's condition and then provide or obtain proper medical treatment, provide clearance to participate, and inform the athlete of risk of participation with particular medical condition. So we have to have a relationship that exists between both parties. So as an athletic trainer and intercollegiate athletes or high school athletes, we have a relationship that exists. So you may be out at a flag football game here on campus, whether it's an intramural or a club, and you do not have a relationship between those parties professionally. So you do not have a duty to properly assess the condition, provide proper medical treatment, or provide clearance, or to provide them with risk of participation. So you may still want to help somebody that's injured their knee, and I'm not saying that you shouldn't. I'm just saying you do not have a legal duty or responsibility to that individual, because the relationship does not exist between our athletic training program and the intramural program. At this point, it does not. It's only with the intercollegiate athletes. So if you were to assess the athlete and you did something wrong, they do not have a leg to stand on to sue you for doing so, because there was no duty there. Next is breach. That's a reasonable person standard. So an athletic trainer is expected to act as a reasonable athletic trainer would in a similar situation. So again, you are held to the standard of an athletic trainer. You're not held to the standard of a physician, but you are not held to the standard of a lay person either. So would 100 out of 100 athletic trainers do exactly what you did in that situation? And that's where breach comes in. If everybody else in the world of athletic training would not do what you did, then a breach was occurred. Next is causation, which is a preponderance of the evidence determines a breach was in fact the legal cause of injury. So it's established when an athlete can prove that actions of an athletic trainer were the determining factor in the damage that was caused. So maybe somebody is injured in a game. You blow them off because they are really a big wimp and they're all the time coming in with the least little thing and they're never ever injured. And so now they've come to you on the sideline, and you blow them off because you think that they're just trying to get out of the game, or maybe they're trying to get out of practice, and you blow them off and put them back in participation, and now all of a sudden they have a major injury on their hands because you blew them off and didn't properly establish what type of injury had occurred. So maybe you had somebody with a concussion, and they act weird anyway, and you don't really think that they're concussed, and you throw them back out there, and next thing you know, you're dealing with a subdural hematoma. That can go right back to that you did not act as a reasonable person, and that you put them in a position to further injure themselves. And then actual harm. So an athlete then has the burden of proof that actual damage exists. So an injured party typically seeks damage for past, present, and future pain and suffering, medical expenses, and diminished earning capacity. So you may have somebody in high school that has earned a scholarship to go to college, and you mistreated them as far as their diagnosis and their level of care, and now they have a permanent injury and they're no longer able to run, and now they've missed out on their college scholarship, or a collegiate athlete that has NFL potential, and because of your actions, they now are no longer going to be able to play. So diminished earning capacity, as well as the medical injury expenses and the pain and suffering. So there's an assumption of risk doctrine. So this is our defense against negligence. It's a legal principle that no harm is done to one who consents. This isn't always ironclad. So even though we have a consent, we need to be able to have the burden to prove that the athlete knew the risk, and then the athlete agreed to accept the risk by written or verbal consent. But we cannot just abdicate our duty because an athlete wants to play. So our athlete is the responsibility to the health and safety of our athletes. So we cannot have a kid that's had 10 concussions come to our team and say, I want to play football, I'm incredible. And the coach says, wow, this kid is incredible. We can't say, if you'll sign this paper, we'll let you play. You've had 10 concussions, next one may be it for you, but if you'll sign this paper, we can't in good faith do that for an athlete. So we need to be able to know how far our assumption of risk goes. Next is contributor negligence. So a doctrine that the athletic trainer may not be held liable if the athlete contributes to their own harm. So we might have, let's say we have a runner, a track or cross country athlete who comes in and has had some shin pain. We send them to the doctor. Sure enough, they have a stress fracture in their tibia, and we've shut them down. We've documented it. The doctor has shut them down, put them in a boot, put them on crutches, and said that they can no longer run. And we've documented this. We've got all the evidence that we have. But this athlete wakes up one morning, feels real good, goes out and runs a couple of miles, and now fractures their tibia. That's contributory negligence. We have done everything that we possibly could. We couldn't shackle this person and keep them from participating. Then you have comparative negligence. This decreases retribution paid in proportion to the degree of harm by liable party when an athlete contributes to damage. Maybe an athlete has had a meniscus repair, and we've told them over and over that they have to be non-weight bearing, and now all of a sudden you see them in the weight room doing squats, and now they've retorn their meniscus. So now they've contributed to their own harm or their own damage. So that's the reason we definitely need to make sure that we have documented things, that we've sent them to the physician, that the physician has documentation, because if we do not put in our documentation, hey, this person is non-weight bearing, this person cannot do any range of motion, knee range of motion past 90 degrees, if we haven't spelled these things out in our notes and to the athlete, to the athlete's parent possibly, then we may contribute to that negligence as well. So most of us has probably heard of a Good Samaritan law. This protects against civil liability for negligence when providing emergency voluntary care. This varies from state to state in regards to categories of who the law protects. So you may have a physician in one state who stops at the roadside and renders aid. That person is going to be judged much different than a lay person who has absolutely no medical training whatsoever. So we do have medical training, but the Good Samaritan law will typically cover you as long as you didn't do something really stupid. If you got somebody with a spinal cord injury, a neck injury, and an auto accident, and you start moving them, and you contribute to further injury, then you should have known better in that situation, and you acted in a way that an athletic trainer wouldn't, even in a voluntary emergency situation. And the reason they established the Good Samaritan laws was so that people wouldn't be scared to stop and render aid. So people would say, there's an accident, but you know what, I'm going to stay out of the way because I might jump in there and do something wrong, and then all of a sudden I'm getting sued. Now I've lost everything just because I was trying to be a good person. And then next is the Volunteer Protection Act. It protects volunteers of nonprofit and governmental entities from liability for harm when volunteering on behalf of the organization. So you may be a government worker, maybe you work at a school and you're volunteering at, let's say, something that's outside of the athletic training scope. Maybe they have a fall festival or something there, and you just volunteer to be on site in case somebody happens to be injured. You couldn't be sued for that. Now, if you are working at a high school, a public high school, and you are working a football game that you're getting paid for, now you're not a volunteer. So if you're working at an interscholastic event, even volunteering, you should not assume protection if providing emergency medical care. So if you're not getting paid for it, then and you're volunteering, don't assume that you're protected. So let's look at risk management, some actions for comprehensive risk management programs. We need to identify the risk of the program. We need to estimate the extent of the risk. We need to evaluate the options to reduce the risk. And then we need to implement policies and procedures to reduce our risk. So that's the importance of our policy and procedure manuals. We often look at those things, they're just so wordy, and we just don't look at them a lot of times as something that's positive. But really, those are the things that help to reduce our risk. So we need to also have a common sense risk management view of things and techniques. So we need to build relationships not only with our athletes, but our physicians, with family members, as well as our administration. I remember I had worked with a professional football player a number of years ago. I was rehabbing an injury, and he had a lawsuit against his team. And he admitted to me one time, that the athletic trainers were really good guys, and he liked them and had a good relationship with them. And it was really hard for him to sue them because of that. So have a good relationship with your athletes. We need to obtain written and informed consent. Pre-participation physicals always help us out. And then make sure that you're keeping records. Make sure that you're documenting your injuries, your treatments, the things that you've instructed the athlete to do. Make sure that we get that written down. So if we shut somebody down from participation, let's make sure that we write that down, that we're going to do that. So statute of limitations is a specific length of time an individual has to sue for damages from negligence. It's usually 1 to 3 years, but for a minor, it's 3 years past their 18th birthday. So we got to make sure we're always keeping our documentation and our charts for reference, because who's going to remember something that happened 3 years ago? Usually you're not going to have that kind of recall. But if you have stuff written down, if you have it documented, at least that's going to help jog your memory of what happened. And we're all familiar with confidentiality. So all of our medical records are confidential. So that includes Presagia. So be very careful with opening Presagia, maybe in your dorm room, or if other people are around that aren't in our department. And also medical records, you should not, only if you're involved in that person's care, should you be looking at their medical record. So you shouldn't just kind of pull through the Presagia and look at things that are on an individual athlete's chart. But if you are involved in some way, or if you've been requested to get their medical record for another athletic trainer, that's fine, but you shouldn't just be rifling through because you have access to it. So a patient must sign written requests before information is released. So we need to make clear who the information is going to and what the purpose is. So a patient is allowed to view his or her medical record upon request. And then the duration of time required for medical records to be kept depends on the state. So each state will tell you how long to keep the records. So usually it's 3 years. It could be up to 7 years. Typically, it's the range. And then we probably don't need to say anything more about HIPAA. The FDA, the Food and Drug Administration, this ensures all medical devices and medications are safe. So the devices that we use, our modalities, are assigned to one of 3 classes. And this is dependent upon the potential harm to a patient. So if there's little risk, it's a class 1. If there's a little bit more, it's a class 2. If there's a great amount of risk, then it would be a class 3. So most of our modalities are going to fall in that class 1. May have class 2 with our laser. And all the devices undergo rigorous testing and before being marketed. So if you have a device that's FDA approved, you can be pretty confident that it has ran a gamut of testing and it's safe to use. And then FDA also regulates the product labeling information and instruction manuals. So you can't just have some yahoo writing up the product label or how to use it. These use professional people on how to write these things so that it best protects you and the patient. OSHA is the Occupational Safety and Health Administration. It protects the health of the U.S. workforce, develops codes, safety standards, and regulations to prevent work-related injuries and illnesses. And we think about the bloodborne pathogen and the training that we do at the beginning of each year, as well as the universal precautions in which we want to prevent the accidental contact with biohazard. We have exposure control plans, and we also have our annual in-service there as mentioned. And that is our lecture for today. We'll look forward to seeing you in class.